support them? How will you help them? So that requires you to have an understanding of how the health systems can support addressing this social isolation and loneliness, as well as the fact that if they have had other health condition, how this can magnify or amplify their health condition. So that's something else you can also kind of guide them towards. So this is helpful to be aware of in terms of knowledge, also helpful to help others if you are not from the practice. The third is, what are the tools available in the industry? We won't be mentioning any tools or products or platforms today, but our intent is to kind of determine how do you really go about assessing which tool or platform will be very effective to be able to use in order to address your overall health condition or for better health. Okay. With that said, we're going to dig deep. So the first one is really setting the context in terms of what is understanding of social isolation and loneliness mean from a larger framework. So first and foremost, a lot of people get confused about social isolation and loneliness as one and the same. They are not. They are not the same. Again, alone and loneliness is also not the same. So how are they different? Social isolation is as an outcome of you being not having an opportunity to be able to interact with people. Okay, whether that's a physical limitation because you are, debilitated, because you're disabled, you're not able to go out and meet with people, or if it is an outcome of maybe not having the opportunity, just like during the peak times of pandemic when we were mandated not to be able to interact with people. So it can be as a result of something that is imposed on you that has made you become socially isolated. It could also be because of a mental health condition. Maybe you're very depressed and you really don't like being around people. Maybe you're a very anxious person. It could be a number of things. But it's really the opposite of socially connected. As human beings, we all need to be always connected. Right? We love the level of connection we can create with another individual or another human being. And that's what makes us human. So when we are socially isolated, we are really going in the opposite direction, leading us to feel maybe less adequate, maybe sense of self-doubt, maybe have increased level of anxiety if in the future we have to connect. So those can really trigger, the social isolation can trigger those kind of behaviors in us, even if it was not there before. The second most important thing is loneliness is actually the perceived distress. What I mean by that is it's not necessarily the physical factor of being isolated, but you could be amongst a bunch of people and still feel extremely lonely. How many times have you been in a crowd of people and you've seen this one person standing alone in a corner, not wanting to interact with anybody else? That's their perceived, and many times amongst our families and friends, you may have noticed people tell you, oh, I have nobody to talk to. They have a lot of friends, but they don't talk to anybody, or they're not able to really share themselves. That's a sense of loneliness they perceive within their hearts. That's a perceived distress that they feel. And it doesn't matter if they're living alone or if they're living with a larger family, or they are in a group of people. It doesn't matter. It's a perceived distress. Third is that when there is a higher risk of loneliness, perceived sense of loneliness, there are higher risk of health conditions, negative health conditions that can occur. So if you have been feeling lonely, chances are it feeds into your sense of depression, anxiety, low self-esteem, so on and so forth. If you are feeling lonely, there are more chances that you're not taking good care of your physical health, leading to other chronic conditions. Maybe you're overeating, maybe you're undereating, maybe you're lacking some nutritional elements, maybe you have diabetes, maybe you have increased heart disease risks. All of those can happen. So basically, understanding the social isolation and loneliness in the context of how human beings interact and where and how you will identify is going to be critical. Okay. Next is what are the findings since the onset of pandemic that the world has noticed? So some of these facts have been very it was eye-opening for me. So I'm not going to read through all of them. I'm just going to point out a couple of them that I thought was very interesting. One was this Vox report that said that about 22% of the millennials, which is the ages between 23 and 38, it's a big age span, right? That they have said that they have no friends. Very important factor not to have, to say that you don't have friends amongst the millennials, the highly socially mobile, digitally enabled population that says almost 1/4 of the population says they don't have any friends is an appalling statistics in my opinion. So that's one. Okay, the second most important one I thought was interesting is the most vulnerable ages are between the 18 and 25 and 50 plus for being socially isolated and feeling lonely. And these groups are vulnerable because between the ages of 18 and 25, higher risks for suicides happen, and above the age of 50 it leads to several different levels of chronic conditions. And not to mention, above the age of 50 you already suffer from certain chronic conditions, but then when you add the social isolation and loneliness to it, it only magnifies the problem even more. So that becomes the third most important factor that has come around since the onset of pandemic is the fact that we moved in healthcare. We have been always backward in digital enablement. So suddenly, when the pandemic hit and we had to be all socially isolated, we went from being all interactive to completely virtual healthcare, not having any human touch and connect. Human touch is one of the healing factors in healthcare. Healing comes from touch, and when that is missing and you're seeing your patients, over a video or virtually, it kind of lacks that same level of connect with that patient. And that led to, maybe as a patient, the doctor has 10 patients to visit over the telehealth. So you're one of them. And so you don't really have that kind of time. You spend about 5 minutes talking about your symptoms. He cannot see your full body, or you have to hold the phone in different directions. It's kind of frustrating and limiting. So you share what is the most important, for important symptoms you're experiencing now, and that's what gets addressed. So overall, to be able to see you in person, to be able to understand and recognize if you have any depression, if you're having any sense of maybe fear, maybe sense of maybe you're not taking good care of yourself, maybe your self-hygiene is kind of poor. All of those are not very visible over virtual. So that's the important piece to kind of notice. So when we went into virtual care, we lost that human touch that also aggravated this isolation and loneliness problems, leading to other health issues. So we're going to move on to the next slide. Oops. Okay, it's not moving. Sorry, guys. Can you see my screen? Okay. So what are the primary drivers and risk factors for social isolation? So there are 4 different primary drivers that are critical, right? One is behavioral, second environmental, third is psychological, and the fourth is physiological. So these are the 4 different drivers that influence and create those levels of risk within each. So in the behavioral piece, one of the main trends that we noticed, it's always been, especially the countries which are aging in nature. For example, the United States or China or any of the countries where there's more aging population, what you would find is the older you grow, the longer you live, the more you have to take care of your elderly at home, and then you're also taking care of the younger individuals at your home. So the caregiving responsibility spans 2-3 generations. That adds to the burden, physical and mental burden on an individual. So that leads to some of the need, like if you have to take care of Alzheimer's or dementia patient, typically the caregiver ends up being very isolated because it's a 24/7 job, in addition to having maybe a job outside of home. So it's a big burden financially, psychologically, etc. So there are some behavioral issues you will notice. They start to become more, introvert, they don't socialize, they don't go out, they don't enjoy life, or major life changes, which was experienced by a lot more people since the pandemic, right? Such as death or disability, or they were in the hospital for a very long time, etc. Environmental is when you don't have access to family and friends, which many of us experienced, or according to the social determinants of health, if you have a financial limitation because of the socioeconomic status, you are not so keen on really spending the money to go on travel because you have limited funds, or you're not able to go out to restaurants to eat. All those can also be limiting, making you kind of stay at home. Or you're in the rural areas where there there is lesser connectivity digitally, as well as, to be able to interact with people. Psychological is when you have, one of the things that I have been noticing since the pandemic is the fact that a lot of individuals that, stopped communicating because they were not interacting with people, is their cognitive ability as they got older became less and lesser in function. Mild confusion, mild cognitive impairment, these were something that was more noticeable if you didn't adopt yourself to some other technology enabled cognitive stimulation. Depression, anxiety is at the heights, right? It's off the charts. Then of course social phobias. Many of the youngsters that attended universities did more so from the safety of their homes, and they didn't really get to interact with other students. And even the presentations they didn't have to really make any eye contact, be around people, be in front of a bunch of people staring at your face. So they ended up becoming much more socially phobic. Last but not the least is the physiological. So this is kind of, it feeds into the other. So social isolation and loneliness feeds into the physiological decline, and the physiological decline leads into social isolation and loneliness. So it's kind of a loop. So if you notice a lot of the sensory impairments, if you're not able to hear well, see well, you're not going to want to be around people because it's kind of embarrassing to be able to ask repeatedly what they're saying, or in a crowd of people. Limited mobility. If you are disabled, wheelchair bound, walker bound, you're not able to leverage the stairs, you're going to not be wanting to go socially, you won't be that active. Chronic health conditions, if you have rheumatoid arthritis or any kind of arthritis where the joints ache and pain, you're probably not going to want to get out and do that. So these are some of the drivers and factors that impact social isolation and loneliness. Next one, that how does it affect the physical and mental? We have already elaborated this so far, so I'm just take a couple of points. One of the most important things you will notice is individuals over the age of 60 and older, when they experience loneliness, they have a 45% increased risk of death. And these are all research findings, latest research findings I had picked up. Another most important thing, the reason for Alzheimer's disease and dementia being more identified within the health industry is because of an association between the social isolation as well as that leading to cognitive decline, and thereby Alzheimer's, dementia, etc., is the outcome of that. 61% of the US adults reported feeling alone post-pandemic. When they say feeling alone, what they're meaning is feeling lonely, feeling by themselves, feeling that they have nobody to take care of them. That's what they feel. So these are some of the findings. These findings are in research papers across Google, so you'll be able to find. I'm not going to belabor this point. I'll just move on to the next one. My apologies. This thing has a tendency to not move fast. Okay, so this is the burden on the health system. One very outstanding data point is this, the bottom one to the left. If you notice, 14% of older adults were socially isolated, but they accounted for 6.7 billion US dollars in additional Medicare spending. It's a stunning figure when you really look at what this, post-onset of pandemic, what it has done to the health systems, the burden it has imposed on the health system. So the Medicare spending of $6.7 billion for about 14% of the older adults who were experiencing socially isolated and then thereby leading to health conditions is a huge number. So it's a big burden on the health systems. Second most important thing to notice is if you look at primary care practices or behavioral health clinics or smaller community hospitals or rural hospitals or larger acute care hospitals, all of them have their own ways to collect this data, but they are not consistent. So it's not like I could go to my PCP and he or she will say, based on my appearance or the way I communicate, oh, you look, so how are you feeling today? Do you feel lonely? Do you feel depressed? Is every physician I go to ask this question, or some of them don't have the time in the day and they just look at the symptom. Maybe I went for a finger cut and it was infected. They just looked at it and said, oh, use this, antibiotic and, stitch it and you should be good to go. And they're not really worried about my other, overall health, the holistic health. So how Are we really being acutely aware as a practitioner, as a healthcare professional, to notice when a patient walks into the room, to identify what it is they may be facing and potentially trigger those questions to make sure at least we have noted it down? That's number one. So that's screening. And if I don't have the time as a healthcare practitioner, because I have to see, I have 20 patients today, my schedule doesn't allow me, can I empower the patient to really take some of these tests in a way that I can find those results by the time the patient is in my clinic visiting with me? So these are some of the ways we really need to empower the health systems so they are not, the healthcare licensed health professionals are not burdened. At the same time, we are able to address the patient as a whole. So this is the most important key takeaway we need to kind of problem solve through the health systems. The lack of standardization and the enormous amount of spending that is happening because of the influence of this isolation and loneliness and other mental health condition on physical health. So how do we really solve this? What do we do? So one of the ways, after much exploration and soul searching within myself and really talking to a lot of healthcare professionals, including me being a professional myself, what I thought about was many of the health professionals, their immediate response to me was, look, first of all, I don't have the time in the day. Second, I don't know what codes to use, what screenings are out there, which one I can use, which one I don't use. There are million screenings. Then my EHR has me do certain things, electronic health record, and that's what I'm filling up. And I'm hoping that's sufficient to get reimbursed, because reimbursement is also another thing. If every time they see a patient, they have to justify their care that they provide. Fourth, I don't have that kind of office staff or people around me to be able to address this on a consistent basis. And then last but not the least, what are the platforms out there? The 100 different platforms. Everybody, I get to see one or the other platform every day, but which one is good for me, how it will affect me, whether I have to do more work up front, whether they will take care of it, none of this I know. So these are the challenges, these are the questions in the mind of many of the practices that they kind of deal with or they confront with, and they don't know how to solve it. So what we have provided is how do you really go about creating a framework wherein when you are about to identify an enabler or when you're about to implement holistic care for your patients, what are the different things you need to look at? So first is, quick a glimpse of what are the different symptoms you need to identify in your patients. Very quickly, when they come in, are they making eye contact? That's the first starting point. Do they have good personal hygiene? Have they dressed appropriately for the visit? How is their body posture? Are they coming in all stooped over, head bent down? Are they upright? Do they have a smile on their face? Do they lack? Are they responding to you appropriately? Are they being, are they avoiding your responses or are giving monosyllabic answers? So these are some of the ways you can see how actively engaged they are and how removed they are from, their visit. So, and also, if you are making a home visit, then we can see very quickly how cluttered is their home. Clutter environment is clutter in your mind, as they say. So it's very easy to see how their brain works. So observations, right? If you're a home health care provider or if you're a care provider in a clinic, these are very quick ways to kind of determine, is the person going through something beyond that meets the eye? Second most important thing is, how do I go about assessing it? Okay, now I know you have a problem. How do I assess it? What are the tools in front of me as a practitioner to assess it? There are various different standardized tests that are out there in the industry. You can pick and choose any one of them. There are some pros and cons listed here, but largely for addressing social isolation and loneliness, typically the industry uses the UCLA loneliness scale. Now these are 20 questions. However, there's a 3 questionnaire that you can always ask the patient to do ahead of time and come to the clinic. Those are only 3 questions. If they answer them, you know how lonely they feel. It's very easy for them to respond, and it doesn't make them feel guilty, or it doesn't, you won't get any incorrect responses because the patient is feeling like they shouldn't talk about their loneliness. So it's very easy to do. So there is a brief questionnaire that you can have them do it and come. So these are just, tests that to equip a practice or a clinic to kind of determine what would work best for them, for their clinic and their population. Next is, sorry about this. Next is, how do I bill for it? So main question among practitioners is, okay, I don't mind having them do these questions, but I need to, be able to document it. I need to justify, adding this piece of information, and I need to bill it appropriately. How do I go about doing it? So the billing codes are also available. A lot of practitioners, when I spoke to them, they were not aware of which billing codes to be used for this. So there are evaluation and management CPT codes. There are ICD-10 codes you would use that would be in this ballpark. Now, a lot of them, as you can see over here, are related to the social determinants of health codes, SDOH, as we say. And this is where you actually assess. This is another 26 questionnaire that CMS Centers for Medicare and Medicaid has posted. It's very standardized questionnaire. It has listed and down into many subcategories. And this is the actual questionnaire, and it has financial well-being of the individual. It has housing challenges. It has transportation challenges. It has food insecurities. It has mental well-being. It has physical well-being. It has how lonely do you feel. So there's about 26 questions and individual answers, which will allow you as a practice to know where the patient is in terms of their ability to even buy medication, for example. If they don't have the money, you can write prescriptions as long as you like, but they're not going to be able to buy it because they can't afford the co-payment. So we have to understand their cultural context, their socioeconomic context, before we go about addressing health for them, right? Their clinical health for them. So this gives you those insights, and you can use these ICD-10 codes and the CPT codes to kind of determine how to go about justifying, their visit that day, making sure that if you are having to provide additional care, if you're having to refer them to maybe a community organization, if you're having to refer them to a home health, maybe get them some transportation, all of those can be justified when you're able to code them and build them appropriately. So this is required. So the next one is the reimbursement and regulatory, highlights. What is out there today? How is this being addressed today? So if you look at some of the, regulatory and reimbursement initiatives that CMS has taken, is they have rolled out this SDOH screening tool that they say, please use this as part of your visits with your patients, because then you would have a broader understanding of what you need to do with your patients. Please use these codes. This is what we discussed in the earlier slide. And as well as the fact that if the patient is in a nursing home, then they must be, these loneliness data elements must be addressed as part of their assessment, early on assessment, because a lot of the nursing home elderly patients have been experiencing extreme level of anxiety, depression, and fear of being left alone to themselves and not being able to interact. And now today, if you look at many of the health systems that are sort of like accountable care organizations, that are integrated health systems, they all are focused on rewarding the clinicians or practitioners based on how well they take care of their patients more holistically, rather than addressing the clinical needs of the patient alone. So symptom-based clinical needs alone. So that is how the reimbursement and regulations are encouraging to include this. And there are many more that are coming in to effect in the near future. So the next one, if you really look at it, how does this digital health technologies, how can they effectively address the social isolation and loneliness? So if you look at the first one, so we created sort of steps to prepare. Right, give me 1 second, please. Steps to prepare for digital health technologies. How do you go about preparing for it? The first one is, you have to, if you are going to implement any digital health technologies to support you, to enable you to be able to help you see more patients more holistically, then you have to understand your existing applications within your ecosystem. You have to know, do you have a EHR system? Do you have a revenue cycle management system? Do you have a scheduler? Do you have a billing system? Are you outsourcing that to a third party? How well integrated are they? Are you using any other third party platforms to address, maybe, filling out the forms ahead of time, whatever that may be. So you need to look at all your existing applications. You need to see how good they tie to each other, how seamless it is. Are there breakdowns in the process? Are you having to repeat the same, duplicate the work in one system, enter it in one system, go back and enter it in the other system? How can you minimize all this duplicate entries? How do you less burden your office staff? So these are some ways to look at it. The second one is to really see what are the new social isolation, loneliness data elements that are out there. How, is that enough just to include these 3 questionnaires? Do I need to include all the other socioeconomic factors for the patients? What kind of population comes into me? Is it largely Medicaid patients? Do they have financial challenges? Should I be prioritizing the social determinants of health? Or, it's largely Medicare patients. They have a lot more chronic conditions. Should I be prioritizing something else? These are all things you need to look at to see what kind of outcomes and insights are you getting from your analytics today. If that is being outsourced to a third party vendor, you need to see what they are producing to you. Is it enough? Is it sufficient? So this is an assessment you have to go through, spend some time, really look at your existing clinic and its practices to kind of determine what is missing there, where are the processes breakdown, why is there so much frustration, why is there higher turnover of your office staff. With the onset of pandemic, another big thing a lot of the clinics are experiencing today is lack of office staff. They're not, their older office staff left. They're not finding new ones. It's across the industries, right? Every industry is facing lack of staff. If you go to a retail store, they'll tell you we are closing early, an hour early, because we couldn't, for the past 6 months, we have put out an advertisement for a, a customer service representative, and nobody has really applied, and the older staff have disappeared, and we have not been able to hire anybody. This is the chronic problem in the industry. As you go from one industry to another, you're going to see this as a huge problem. Even in the grocery stores, you see this problem. The third most thing is really initiate and establish what kind of patient education toolkit do you have handy? How do you really share that with the patients today? Is it manually? Are you printing it out? Are you able to digitally give it to them? And how are your staff? Are they trained? Are they well equipped? Do they know how to really improve the efficiencies? What do they need to do? Are you adding more steps to them? Are you reducing the steps but making it easier for them? How are you enabling them to really enjoy their work? And then fourth is study and monitor the outcomes. So first, you look at the outcomes you're receiving today. So your reimbursement gets better when you are able to integrate the person as a whole. So what are the outcomes you're noticing today? Is it better, good, worse? And once you implement this on a trial basis with maybe a subset of your population, you can then compare and see, is the outcomes getting better? It'll be a 90-day journey to begin with minimally, but that's how you'll be able to track and monitor and then determine what is working, what is not working, what is duplicate efforts, where maybe you have additional application that you can retire. All of those can be reassessed. So this is an ongoing process. Last but not the least is the hundreds and thousands of digital health platforms that are out there. Everyone trying to do something different, something unique, something better, right? So what is it that will best suit your clinic? What will help most your practice? That's what you need to look at. There may be fantastic platforms out there, but does it suit your needs? That's the most important thing to ask yourself. So some of the expectations, so I'm just kind of giving an expectation template in terms of what you should expect out of a digital health platform. So primarily, we all know this: better care, better outcomes, reduced burden. This is what everybody is hoping and aiming for. So within that, how do you really go through that journey? First, we all know that it has to be patient-centered. What does it mean to be patient-centered? We have to find out, is it easy for patients to use? Older, younger, visually impaired, how easy it is. Is your patient population largely digitally enabled? Do they have smartphones? Can they use this? Do you have have all of these self-assessment tools like the social isolation and loneliness that they can take ahead of time and come. Maybe they fill out all the patient medical questionnaire ahead of time and come. Is it all clickable? Is it easy for them to view? Is it easy for them to understand? How simple have you made it? Do you have 20 questions? Do you have 10 questions? And how easy it is for the caregivers to access or care providers to access the information that the patient puts in there. Are they able to look at the same screen in real time and help the patient if they're having challenges, or are you having to go to a different platform to see it? And can the patient track their own progress? Intrinsically motivating the patient should be a key. Are we able to do that? Then next one is the data driven. How easy it is to look at the dashboard. Is it complex? Can I, is it going to overwhelm me? Is it very busy? I'm able to really look at it very quickly and say, you know what, I didn't do that walking yesterday, terrible. And I've got to go back to walking this. I was really losing, 5 pounds and now I've gained that. Is it easy? Is it going to intrinsically motivate them? Is it intuitive data driven? The sense, I know I didn't walk yesterday, some reminders, the iPhones kind of give you reminders. Oh, you did 4 miles yesterday, today you didn't do much. So it kind of gives you those kind of activity recommendation. Those are the things you need to look for. Is it future interoperable, even if it is not now? Cloud enabled, right? What is the maturity of the AI that the digital health platform claims to be? How good it is? How accurate is it? How insightful is it? How intuitive is it? What is the level of automation this brings in? Because the intent of a digital health platform is to reduce the burden on the care providers. But if it is not able to do that, I mean, the first few months of implementation, there'll be a learning curve, so it takes more out of you than any time else. But then it should consistently progress where the health providers, by the end of 90 days at the latest, they should be able to easily use it and go forward. And I say 90 days because many health providers still continue to have technical challenges, so there is a higher learning curve than any other industries. Then ease in implementation. How quickly can you embed this within your existing ecosystem? How easy it is to integrate. Again, licensed care provider ease. So one of the things in the digital health platform is not make it completely virtual. A lot of platforms will say it's totally virtual. You don't need to have human beings. It's just patients can use it. That's when the connect gets removed. You don't want to do that. There has to be some human touch, human connect. How do you build that without burdening the licensed care providers? Because they don't have the time in the day to do this. Can you train some certified staff that can maybe provide an additional level of, maybe listen to the patient if they have any grievances or maybe some fear or anxiety around their illness, maybe provide some phone support. Those are the things you should, like a friendly call. Those are the things we should be really looking for. Security, of course, this is data breaches are a big thing right now. Office of Civil Rights has really paid a lot of attention to healthcare and the data breaches. So we need to be really cognizant of the fact that any data platform that we bring into the fold, digital platform, that their security systems, their data breaches, the risks are all very well assessed before you actually adopt to that particular platform. Last but not the least is how do you really create that active patient engagement? How do you really create a more integrated health focus? Can it really, this platform address both chronic, mental, physical, isolation, all of these factors into one? Can it give a big picture of the patient, not treat them for individual conditions, but together? And how do you really drive towards an evidence-based practice over a period of time? So, if you really look over here, the intent is to kind of optimize health and compliance, create evidence-based practice models over time, make all your technology landscape within your ecosystem more robust, scalable, and AI dominant for the future readiness. And then, of course, this builds the confidence with the clinical team and leads to become more intuitively insightful in terms of what you provide and what you get out of it. So these are, and whenever you're assessing a platform, consider some of these factors. What does the platform give now? And don't expect everything now. Some of it will be there, some of it will not be there. What does it give now? Is it enough for you to get started? What will they bring in the future? Is it aligned with where you want to go in the future and the speed to implement? So now I'm going to move on to the next slide. We have a few more slides. So last but not the least is, just really once you have this assessment, when you go through a digital health platform assessment, when you realize what are the factors that you will consider, that's when you will then have to determine, nail in on which platform you're going to use, how you're going to use it. And in summary, I just want to say one thing, right? Moving away from human touch or human connect to only digitally enabled health platforms is not the should not be the end goal. Our goal should always be having that human touch with some technology enablement, so we are able to adequately address the patient needs and not have them so removed that they are hesitant to share their symptoms and conditions and fears and anxieties with the care professional, and they feel safer to be able to know when they need to reach out to and when they can use a digital app. So there has to be a balance between the two. That should be the ultimate goal, where we will get a very integrated, holistic care for the patient that will drive towards better health and outcomes. I'm going to pause here. This is the end of the session, and take any questions anyone may have. Any questions? There is a silence. Yes.
Can I ask, as a host, this is Ravi.
Yeah, sure.
So, are there any platforms that are intuitive enough that can streamline one's mental health journey, or any
Uh,
platforms that have inspired you?
Well, we within Sparity, we also have access to a platform that we are actually, we have developed it as a full-fledged product and a platform. So we do have access to that. That would be called Dr. Right, and that is now in United States. It's being rolled out within the Medicare population. So that is available. It is a digital companion to a health ecosystem. So we call it the digital companion because what we have really tried to strive towards, and I won't say accomplish yet, but strive towards is really bringing the integrated future of chronic illnesses, physical illnesses, and mental health together under one single view for the patient. So it's not just about, okay, you have diabetes, I'm going to assess your HbA1c and your report your glucometer readings every day. And then if you have high sugar levels or low sugar levels, or if you're in a diabetic coma, then you do X, Y, and Z. Not like that. So there is always an associated illness that comes from a physical illness. For example, a lot of patients in their journey of diabetes, which is irreversible, can end up experiencing depression at certain points in their life, a little bit more acutely than others, possibly. Then there may be, diabetes also leads to potential heart conditions. Then if you have had, maybe a depression for a really long period of time, it's possible that can cause you to have other chronic conditions such as, maybe chronic pain. It could be your heart condition. It could be more ED visits, emergency department visits. All of those can happen. So they are all tied in together. So within Doctorate, what we are trying to strive towards is bringing all these different conditions into one individual or one single focus, so we can ask these questions. One question intuitively leads to the other to be able to determine for the patient what are the different things they're experiencing and how do we address it. So that's what we have done. But there are many other platforms out there that people can assess and look at and see how it will help them. Did I answer your question, Ravi?
Yeah. Thank you, Jay.
Yeah. Any other questions? Okay. If there are no further questions, I think we can say that, we concluded this session. And Ravi and Harish have shared this PPT with you. I will share a PDF version, and those of them that have attended the call can receive that as well.
I think
I don't see any other questions. I don't see in the chat or anywhere.
I think that's all we have got.
Okay.
Today.
You all have a nice evening or a nice day, rest of the day. Thank you for attending this session. We will chat with each other later. Thank you.
Thank you everyone for joining us. We'll see you next time.
Okay, take care. Bye.
Bye bye.